My name is Donita, and I am a patient of Dr. Haddock's. I am so pleased that he is here at UT Southwestern because I wouldn't want to go anywhere else to begin with. I've been with UT for over 20 years, and Dr. Haddock has given me the confidence in my body that I hadn't had for the last 20 years. Because of my first round with cancer, I don't think that there is a better plastic surgeon. He has great bedside manner. He listens to you and really gave me back my life. As far as being comfortable in clothes and being out in public, I suggest to anyone having cancer that if you have cancer in one breast, and I wished I would have, just had the double mastectomy to begin with the reconstruction, instead of it being almost 20 years apart. It makes it easier if you're doing reconstruction. If you have them both done at the same time, you get so much better results, and you won't have to go through cancer a second time. When you get diagnosed, the first thing you think of is, oh gosh, I want to live. And so when you start thinking about the steps you need to go through in order to survive, and then they bring in a plastic surgeon on top of that, that's really the last thing that you're thinking about. But it's something you do need to think about because you are going to get through it, and you are going to want to have some semblance of familiarity in your life. So you are going to want your body to be as much of what it used to be, so you can feel like yourself. And I think that was one of the things that I didn't feel that happened to me on the first go around with my surgery. And I only had one breast removed because the breast never felt right. It felt like it was not even a part of my body. It felt like it was just an object that was there. When the cancer came back in the other breast, I knew I was going to have a mastectomy on that one. Dr. Haddock and I discussed just going ahead and removing both the breasts again and redoing them at the same time in order to get a more even look. Or at least that's what I asked Dr. Haddock if he could do. And he said, yes, we can do that. That was the best thing. I just got out of his office from seeing him and told him, I said, I don't think my breasts have ever looked as good as they look right now. I mean, even as I was growing up. So I told him, I said, I think they look perfect. And he says, if you're happy, I am. So speak with Dr. Haddock. If nothing else, just get a sense of who he is as a doctor, because he will listen. He will do his best to give you what you want. I would choose him all over again. If I ever had to do it, I would choose him all over again.